Let's go to Phoenix, Arizona and speak to Dr. Zaheer Shah, who's a primary care physician. Dr. Shah, welcome to the program. Let me put it this way. I'm going to use Governor Ron DeSantis in Florida, a Republican, as an example. Florida's coronavirus cases have jumped 50% this week. And DeSantis says when schools start again next month, that schools don't have to force their students or staff to wear masks. He says there's no evidence those masks prevent outbreaks amongst people in schools, whether they're students or staff. Are masks less effective against the Delta variant?
No, in fact, the masking is a critical defense against the Delta variant. You know, the idea of masking and social distancing is to prevent the spread of the coronavirus responsible for COVID-19. Well, the Delta variant is twice as infectious as the original variant of COVID-19 that we've been dealing with. So the idea that masking doesn't work against the Delta variant or is not a good idea in the current circumstances that we face is utterly preposterous. And frankly, it's one of the reasons why the southern states and the Appalachian states are showing the highest prevalence of the outbreaks of the Delta strain, is because vaccination rates are low there and compliance is low there. And it is absolutely unforgivable that the leaders of these states are helping to propagate this misinformation.
When you say twice as infectious, a lot of European scientific agencies have said their research shows that the Delta variant is not more deadly. So when you say twice as infectious, do you mean more transmissible, or do you mean more likely to cause serious disease?
Well, that's an excellent question. And I'm not talking about the gravity of the disease. In fact, from what we understand, the Delta variant is no more dangerous in terms of actual mortality or morbidity than the original variants that we've been dealing with. But it's about the ability to pass from person to person. So let me give you an example. The older variant, if I had it and I wasn't masking and I wasn't doing social distancing and I walked into a room filled with people, before I left that room, 2.5 of those, 2.5 people would now also have COVID-19. Now that Delta variant is the leading version of this virus, me walking to that same room, again, not masking, and again, not practicing social distancing, before I left that room, 4 new people would be infected with it. And that's one of the challenges of this and why the CDC has been forced to revise their recommendations, because of the infectivity of the Delta variant.
You're quoting some really worrying numbers, and another worrying statement from the CDC in this internal report is that those who are vaccinated are just as likely to pass on the virus as those who are not vaccinated. What is it about the Delta variant that makes it able to maneuver around the current vaccines that we have?
Well, let's be clear about something. Even the older variant could still be infected, could infect someone who had been vaccinated with either the Moderna or the Pfizer vaccines. And now what we're seeing, I just had 2 patients last weekend go to some sort of a communal gathering, and they both came home with COVID-19. Both of them had had the Pfizer vaccine. All we're hearing now is more cases of what we call breakthrough cases, because the Delta variant is more infectious. But even with the older Alpha variant, it was happening. But the good news for those of us who've been vaccinated is that while we're still passing it on and therefore pose an epidemiologic threat to the community, the infection itself, thanks to the fact that we've been vaccinated, will not likely result in us being hospitalized and will not result in death. In fact, Pfizer is maintaining about a 97% efficacy in keeping those of us who've been vaccinated with the Pfizer vaccine from ever being hospitalized, even with what we call a breakthrough infection. That's an infection with COVID after being vaccinated.
Dr. Shah, I want to just end, if you don't mind, with your assessment of where we are in terms of vaccinating the whole world. Because we've been told for months and months that it's not a question of just money, it's a question of bottlenecks in production, and there are other issues as well, that even if you threw all the money at the world at it, you wouldn't be able to vaccinate the world immediately. And yet, about 6 weeks ago, The Economist magazine had a leading article that said actually the world can vaccinate, the richest countries in the world can vaccinate the whole world. It will cost them only $50 billion. And being The Economist, of course, there was also the economic return on that. The Economist saying that once the whole world is vaccinated, those rich countries will make a profit of more than $1 trillion in trade, because everything will then be open again. Why can't we vaccinate the whole world quickly?
Because we live in an age of ignorance and polarization. That is the only reason why we're not able to do that. We have the technology, we can get the logistical support that we need to get through any bottlenecks, and we've got the money to do it. Westernized, industrialized, first world countries can see the greater picture and the greater good in doing this. I think they're able to do it. But what we can't seem to overcome is the self-inflicted wounds of ignorance that I believe are being propagated by social media and this age of technology and digitalization that allows those amongst us who are ignorant to find fellow idiots that then become echo chambers, and they propagate half-truths and misinformation that is confusing the populace and making so many people that should just be getting the vaccine not actually getting the vaccine through choice. That's the unforgivable part of all of this, is that these are self-inflicted wounds. The perpetuation of this pandemic is something that we as human beings are choosing to do.
Dr. Shah, it's always so instructive to hear your analysis. Thank you so much indeed, Dr. Zaheer Shah in Arizona.